Hello and welcome to Chapter 4, Key Highlight Video, Operationalizing Social Work Values and Ethics. Social work values aren't simply words we memorize. They must guide how we speak, make decisions, protect the clients, and respond when situations become complicated. The core message that I have for you guys through this chapter is knowing social work values isn't enough. We operationalize them by turning those values into ethical actions and decisions. So let's talk about the six core value that we have that they guide our practice as social workers. The first one is service, and we spoke about these core values in chapter 1. Service is responding to client and community needs. We're providing a service. Social justice is we're challenging unfair barriers and unequal access to opportunities and resources for all of our clients. Dignity and worth, this is when we treat people with respect. I told you, treat people the way you like your family to be treated and the way you are to be treated. Human relationships, we thrive on relationships. Those aren't regular human relationships that we're developing between us and our clients. Those has to be professional with boundaries while keeping your authenticity, while keeping your genuineness and empathy. Integrity, this is when you're truthful, this is when you're responsible, this is when you're ethically always consistent, you're providing the services at all times at the same level. Do your best with whatever you do, always. You won't regret that. Now, competence, this is when you're aware of your knowledge and skills. If anything is needed, please improve on it. Please seek supervision. Please reach out to any other training out there and get that in place for you. So, values tell us what the profession stands for. Ethics help us decide how to act. And keep that in mind. Those are two beautiful sentences that I want you guys to keep in mind. Now, when we're talking about operationalize, when we do that, it means that we're turning a concept or an idea into action. How does that show up in the practice? For example, when you're actively listening, when you're present and available, psychosocial, emotional to your clients, that you're respecting their dignity, then you're being there available for them, regardless of what the situation is, right? When we're identifying barriers, when I reached out to the agency that I worked at and really advocated for interpretation services, this is when social justice it presents itself in action. Okay. Now, when we practice integrity, what do? We let them know about what we do. We let them know about our role, what to expect. We're being honest. We take ownership if we make any mistakes. We let our clients know that I'm not sure of what you're asking me about, but I will make sure to get you answers. Be comfortable telling your clients that you do not know because we aren't born to know everything. As we graduate, as we build our career in the field, this is how we develop experiences. And guess what? Every day is a different experience. You'll come across similar situations, not necessarily truly the same because we're diverse. We handle things differently as human. So social work is always happening. It's always living. It's evolving. So as a therapist, as a clinician, seek into that. Evolve always. Examine your beliefs. Examine your ideas. Be present. Challenge yourself. Don't stagnate. Social work field is an evolving field. Okay. Now, values become meaningful when the clients can experience them through our actions. Okay? Let's talk about some of the ethics or ethical ideas or concepts that really the chapter focuses on as well. We have self-determination, we have confidentiality, informed consent, and boundaries and professional responsibilities. All right, and then personal values and cultural humanities. Let's touch base on every single one as these are pretty important concepts I wanted you guys to pay attention to. Self-determination. What is self-determination? Self-determination is the right to have your client make their own decision and respect that, right? Now, what's my role in that? My role within self-determination is to explore options with the patient or the client, to explain these options, to discuss the risks and the benefits, to explore consequences, and to support that informed decision making. So that's my role. My role isn't to influence their decision, isn't to make them base their decision off of a value that I value. It's all about them. So explore, provide that knowledge, provide that information needed to help them decide within that situation. Now, what could limit self-determination? What could limit self-determination is three things. One of them, or the first one that we look at in the emergency room to decide on self-determination or whether a patient is able to make their own decisions, is we focus on capacity. Are they at a mental capacity that they could make their own decisions? And we have examinations that we perform by other disciplines to let us know and give us a better insight where they're at with their judgment and capacity of making those decisions. Now, if the patient is at a serious or immediate danger, then their capacity to make decisions truly will affect or jeopardize their life. So we need to pay attention to that. Now, the third one is abuse or neglect. If the patient is being abused or being neglected, their capacity to make decisions toward the situation is not fully based off of clear judgment, okay? Pay attention that those limits your role walk in to provide the education needed. I come across a lot of patients in the emergency room who needed placement at a rehab centers after a fall. My assessment walking in, because my assessment walking in wanted to learn what their support is looking like at home and whether they have family nearby, or if they're at an assisted living facility, what's their arrangement at home outside of the hospital settings that they're in. Reason one is it helped me decide, or it helped me understand the choice that the patient is about to make. If rehab placements was in place and then the patient, of course, within capacity to make those decisions, declined that rehab placement and requested home health care services with a nurse, physical therapy going into the home once a week to provide services, and then the patient does not have family, lives alone with minimal resources. This is where my role is to come in, educate the patient about the options available. We can send it to a rehab agency or facility, and those are the choices available. This is how much your insurance would cover. So we'll go through the process. I'll explore, I'll explain options, I'll let them know. Now, I look at the benefits and the risks. I explain a placement at a rehab temporary, what would be the outcomes versus going home with home health care, no family support. Okay, I will discuss those risks. Then we explore consequences. I'll be honest with them and blunt that they could fail improving while they're at home. And if you choose to go home with home health care versus being at a facility, that they might fail, and then they will interrupt their baseline and their level of care. It gets interrupted. So I'll explain all of that. I'll let them know that the home care agency, a discipline can come in into the house once a week. So you're left with nobody to come in. And then I would look into the financial resources available for them. If they choose to go home with home health care, then would they be able to afford caregiving services? Then I provide that information and we'll set it up. So looking at those, so it's more of an educational theme when it comes to self-determination. Respecting a decision does not require agreeing with it. Sometimes I'm so in a disagreement of the patient going home with home health care with no family support, no caregiving support, or any other resources. And that isn't within my values. But if I've done my professional role and I educated my patients on their options, benefits, and risks, then I've done my job and they made an informed decision. All right. When we're speaking about confidentiality and informed consent, now, those two pieces or two concepts we touch base on when we first initial in our first initial with the meeting, the first time I meet my clients, this is when I'm discussing confidentiality and informed consent. This is when I'm letting the patient know about my role, treatment, what to expect, what are the services like, what the information going to be provided all about, that the client has the right to decline any services, or if they're feeling comfortable to stop the session. And so this is where we going through the logistics with our clients about the services we're about to provide. Now, we discuss confidentiality and we let them know that we break confidentiality in three situations, which is harm to self, harm to others, and when we have court requirement, or the last one is in a child abuse cases. Now, when it comes to situation where we need to break confidentiality, please, 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 please make that release of information is so limited and geared toward the treatment plan versus any other information. So make it meaningful consent. Do not just share anything and everything has to be limited, related to treatment. Now, when we're talking about boundaries and professional responsibilities, please draw those boundaries with your clients. When we're talking about clients, think about dual relationships, conflict of interests, gifts, adding them on social media, giving them your personal information, giving them your personal email. Keep those boundaries and professional responsibilities in place. We're the professional, we're the one to draw those boundaries or those lines and make them clear to our clients. Don't add them as a friend on social media. They're not your friends. They're not your family. You will cause actually more harm than good to them by friending them. There is a professional relationship in here. It's not a friendship. And that's why we refer to it as a professional relationship. Don't buy your client gifts. Don't let your clients shop on your Amazon accounts. I have seen some disciplines I worked with where they bought gifts or let their clients shop on their Amazon accounts. I have witnessed clients calling one of the people, my coworkers, one of the people that I work with, when we were on a home visit with them and asking if they can pick up soda for them. That's not okay. That's ethically incorrect. So please draw those boundaries. You can care deeply about your patients, but at the same time, you can't remove that relationship, that professional relationship. If anything where you're unclear or unaware if you're doing the right thing or not, your code of ethics is always your guide. It'll guide you through those conflicts and those dilemmas. Second, reach out to your supervisor, reach out to a coworker, get supervision, counterference, inner counterference, those big hit that they needed supervision and that they needed therapeutic guidance, even as a professional. We need that, especially early on in your career in the field, okay? Now, when we're talking about personal values, when we're talking about cultural humility, we talk about that. Be open, be curious, examine your inherited beliefs, take the moment, take the time to review them. And even in your beliefs that you adopt, they're subject to what being examined as well. We can't just continue with rigid beliefs. Our career, our field isn't rigid. It's always evolving. Do you know why? Because it involves the human relationship. It involves humans, okay? Now, ethical decisions and making. This is very beautifully, this is one aspect of our field or our career that I beautifully adore. Ethical decision. I'm all about ethical practice and legal practice, but I'm not a robot out there. I'm still feeling my client. I'm still creating that safe space to them. However, we can do both because both the truth exists. It can't be done one without the other. It has to be both presented. And that what makes us different than any other discipline. Okay. Now, with ethical decision making, you're going to come across conflicts no matter what. Doesn't matter whether you're early in your career, whether later in it. Like I'm in the field now for about 10 years, coming into 11, and I'm still coming across conflicts where I needed just assurance that I'm doing the right thing, that it's being addressed correctly. Now, Always identify the conflict, look at it, see what's it all about, where it's stemming from, what does the code of ethic kind of reflect on that topic specifically, and how it can be addressed. Not necessarily through the code of ethics, it'll tell you what to do, but it will give you guidance, it'll give you facts to base your decision off of it, right? Consult, reach out to your supervisor. If supervisor isn't available, reach out to one of your coworkers. You'll come across a lot of coworkers with different strengths. Mine as well. Reach out to them. And then form that decision. And usually your intuition will guide you to the right decision if you follow these steps. Ethical practice requires reflection, consultation, and accountability, not simply good intention only. Okay? All right, keep that in mind. So reflect, consult, and be accountable. Hold yourself accountable. One a situation I remember in the emergency room, I had a family with their elderly mother who had a fall, needed a placement. I had a conversation with them as a family. Honestly, family were pushing for a placement. The patient does not want placement. So I came to a realization where I needed truly to speak to the patient by themselves, not necessarily including the family, but at the same time, I spoke with the patient, I explored the option, I asked what's the hesitancy, and we just developed that dialogue around it. And I understood a lot more of what was presenting, that she fell and needed placement. And then I had a conversation with the family. I didn't ignore family. You can't ignore family. Family are a huge part of our patients. So I have a conversation with the family now, and I explained kind of like the patient's views of that placement. Then we had a conversation all together, and finally we came with a better informed decision that could support both parties and make our patient happy. So conflicts happen, seek supervision for them, reach out to coworkers, explore, sit with it, don't make a decision right away, make sure it's coming out of clear judgment. Okay? Now, the final takeaway. Values define what the profession stands for. Ethics guide the professional behavior. Self-determination, we gotta respect informed client choices, even if we don't like them. Confidentiality, we protect privacy and trust, but when it needs to be broken, it has to be broken, and our patients needs to know. When I do any CYFD reports, by the way, I've always informed families that I'm doing the report and why I'm doing it and what are the justification behind it. That's my preference. Would that be your preference one time? Look into it and experience it and make that decision. Self-awareness. Self-awareness, this is when we separate personal beliefs from professional responsibilities. Boundaries, this is when you protect the helping relationship. You aren't just only protecting the helping relationship, you're protecting yourself from burnout, from compassion fatigue. Have those boundaries in place. Now, the question that I'm going to leave you guys with is, what social work value feel easiest for you to practice? And what value may become difficult when a client makes a decision you strongly disagree with? Now, social work values become real through our behavior. Ethical practice means making intentional decisions that protect dignity, respect the client choices, maintain professional boundaries, and hold us accountable for how we use our power.